Viewers, you're welcome to this edition of Sight Ed. It's actually a very interesting one and a peculiar one at that, and you will soon find out. I remain your host, Feyi Adepoju, on Sight Ed. In the course of producing Sight Ed, we've had to use 3 different films. The first one was on cataract, which was titled You Are My Eye. And the second one was on glaucoma, the still water, that was the title. And then the third, which was the last, and definitely not the last because others will come, and is not the least, was on ocular injury. And it was titled Sight Snipers. Yeah. It's basically on causes of eye injury and how to avoid or prevent eye injury. And why I'm excited about this episode is because today with me are 2 other ophthalmologists, eye doctors, eye surgeons, who were part of the cast of the 3 films, myself inclusive, who have decided to, in addition to using knives and drugs and injection to treat eye diseases, they've decided to, be part of enlightening people on eye health issues. Sir, can we meet you? Just introduce yourself, sir.
It is a pleasure and a privilege and honor to have to take time and talk or participate in this Sight Ed, because honestly, it's one of those things that I consider as giving back to society, because from our primary school, secondary school, university days, the society has been contributing one thing or the other to support us. So these are only 2 ways. By the way, I'm Ayani Abdul Kabir. I'm honorary consultant ophthalmology with University of Abuja Teaching Hospital. I also double as associate professor of ophthalmology, University of Abuja, Abuja, Nigeria.
Thank you very much, sir. We'll soon hear more from Associate Professor Anyoni. Sir, can we also meet you?
Thank you, ma'am. My name is Abikoye Peter Olasukomi. I'm a senior registrar in ophthalmology at the Olabisi Onabanjo University Teaching Hospital. It's a privilege to be here and to be rendering this service.
Why have you decided, what is driving this educational program in form of drama or film or an interview and all of this put together?
Thank you. Communication can be in several ways. And then what is important is to reach the audience so that at the end of the day, the aim or the goal will be achieved. We have burning of eye problem in this country. That's a fact. Attested to researches, reports, what we see in the clinics. And then we discovered that many of these people having eye problem, especially those that are blind, when you analyze them, 8 out of 10 are having blindness due to conditions that can actually be avoided. They are either preventable or curable. So if we keep on staying in the clinics, we don't go out, we don't form group or support group like this so that we reach out to the populace, the thing will continue. We don't need to put a stop. And then one way of doing it is cited like this so that people at home, they can, those who have opportunity of viewing it, they will view it. Those that can read, there are a lot of literature where they can be. I know quite sizable number of Nigeria watch.
You're correct. Well, thank you very much. You've actually said key things. The first being that 8 out of every 10 blind people in Nigeria need not be blind because the causes are avoidable. Either they are easily treated or they can be prevented. So, to me, that's something that keeps gripping my heart when you receive people in the hospital and they are blind. And particularly those who come when there's really nothing you can do for them again. And so I quite appreciate what you've just said on that issue. The second thing which I've mentioned in passing is that I do know I'm a proud Nigerian. Many of us like to watch, you know, television. We like to listen to entertainment or educational materials. So I think it's just apt that we're bringing it right at our doorsteps instead of all the big grammar that these people, don't mind them, will keep speaking in their various hospitals. Now, over to you, sir. I know you were part of UMI, just like Dr. Ioni was part of it, and myself, and then the one on glaucoma, and on the one on trauma. Why are you interested? What motivates you? Because viewers, I must say to you that we're not paying these. We're not paying anybody to do any of these things because we really don't have the fund to be able to pay them. But I'm excited that highly experienced, learned ophthalmologists are coming in to act and, you know, just teach us about basic thing on eye health. So, what motivates you?
Thank you very much, ma'am. One, the passion for the care of the vision of people. And then, you know, from the years I've spent, we run our clinics every day. We see a large number of patients. But yeah, the statistics on avoidable blindness keeps increasing. So technically, that shows the clinics are not enough to curb the menace. So sometimes we have to abandon the clinic to come and do the preventive aspect, which is education. And doing it in this format, video, films, drama, programs like this, we also go a long way in preventing avoidable blindness. So rather than allowing people to become a victim before doing something, before they cross the bridge, we just warn them that there's danger ahead, don't cross. So that is what we seek to achieve. That has been the driving power that has brought me to come this far, acting and educating people. Prevention, they say, is
better than cure.
Yeah. It's also cheaper than cure.
You're correct. So prevention is not only cheaper, it is better, you know. So we want every one of us to join in this crusade of prevention of blindness. We do not want people to be avoidably blind. And the data, the statistics we get from many developing nations are actually not encouraging, you know, just like many other of the health indices. And so something needs to be done very drastically about it. So let's quickly go over. I'm going to start with Dr. Abikoye. Can you summarize what is it that UMI, the film on cataract, one or two key messages? I know many of your viewers have watched UMI in one way or the other. Of course, we still also have all of the films on the website, on our YouTube page, and you have almost all the contact addresses where you can, you know, contact us and then watch these films all over again. But can you just summarize the lessons from UMI?
Thank you once again, ma'am. To me, UMI is as specified in the title. We all have a pair of eyes. When they are no more functional, sometimes our fingers takes up the function we feel for things. But sometimes people around us also need to take up the function to help by way of support, by way of giving information, by way of providing assistance, maybe financial or whatever. So it means that just like being a brother's keeper, that where my eyes are no more there, you out there, you are my eye. So that's the...
Well, yeah, we have just touched on a very important issue, but I'm sure we're going to come back to that. How can each of us in the community, as individuals, as organizations, can be eye to the other people? But you know, also when I look at that title, "You're my eye," I say to myself, these two pair of eyes don't go anywhere. You are mine. You know, you just have to keep functioning, not just now, but all through. But we do know that UMI was a film on cataract. Cataract is the commonest cause of blindness all over the world, Nigeria inclusive, and cataract is something that can sometimes be prevented if it's from trauma or diabetes, but even if it's already blinding, it can be cured with a surgery, which is not expensive and often have very good outcome. Don't want anybody remaining blind from cataract. And as we say, if you look around you, you see elderly people or children, and there's anything white within the black area, it may be cataract. Help them to get help in the nearest eye hospital. Now over to you, sir, Dr. Ayoni. Before we go there, can we have some other short clips of those 3 films where any of us have actually, you know, forgotten that we're eye doctors and we're just at that moment an actor and an actress.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Baba still remain blind even after seeing doctor in town?
Abiu.
What did the doctor say?
The doctor said there's nothing anybody can do to make Baba see again. Not even the Oyinbo.
Sorry, eh? Sorry. I will see you when I return.
Okay.
Baba, now welcome. Sorry. Take care, hello.
Brother, why is it that Papa is not seeing me again?
Jude, I don't know.
There are about 3 people that are blind in our village. Why?
Jude, I don't know. It's only the doctor who can tell us why people go blind.
I will make sure I become a doctor when I grow up and treat all the people that are blind in this our village.
Jude, that's very good. That's good. But you need to put this in your mind. You must read your books. Read your books well.
Hey! So what took you so long? You know you have been hours out of this house just to go and buy fruits and vegetables.
There was traffic jam along the main road, ma.
And your common sense did not tell you that you should take another route.
Sorry, ma.
What is this?
Plantain, ma.
Orange. Can't you see these things are rotting?
These are fresh, ma. They are fresh plantain.
Are you blind? Take from my hand. Go on, throw these rotten things into the dustbin.
In fact, the only way to know that there is problem is if the person comes for checkup. And as you see, it usually starts around the age of 35, 40 and above. So you need to bring your family members. That includes your sisters and brothers, both senior and junior ones. And at the same time, your children. They need to be coming for checkup at least once in a year.
Viewers, welcome back, and I'm still on with Associate Professor Ayoni and Dr. Abikoye. Now, Dr. Ayoni, sir, this film, the Still Water, can you just give us 1 or 2 key things on the film? You know, 1 or 2 take-home messages on that film.
Okay, thank you, ma'am. The Still Water is on glaucoma. How glaucoma can silently steal away the sight. Like some of us probably have known of have had, glaucoma is a devastating eye condition. And then it can actually take away our vision, especially if we don't know on time. So the film on the still water is all about creating awareness among the populace, so that they are aware that there is eye condition called glaucoma that can take away their vision, and that if they know early and they access care at a normal place, those are the keywords. Appropriate place. Yeah. They can maintain their sight till the end they will live, when God will call them. Essentially, glaucoma has no respect for individual. It has no respect for race, color, or if not only that, in some there are evidence that so that glaucoma can occur in family. It can be have some level of genetic. Most other glaucoma, they can occur without having any family links. So the best thing is to be checking our eyes, especially those from families where maybe one's mother, one's nephew, one's uncle, or one's even child or siblings has been told that, okay, you have glaucoma, something like that. Even when one is not told, once you are about 35 years, because it's very common after 35 years of age, we should check with our ophthalmologist. You know, we have, even at those days when you don't have ophthalmologists around, even if you have to travel a few kilometers before you can get one. And then I want to disabuse our mind from that belief that once you get to eye clinic, they will charge you. Screening. Most of, in fact, yearly now, Nigerian Ophthalmology Society, Nigerian ophthalmologists, they do yearly screening during what we call glaucoma week. And then even apart from glaucoma week, if you go to any eye clinic and say, please, I want my eyes checked, am I having glaucoma? Most ophthalmologists will not take a penny. They will not take kobo, because we use kobo in Nigeria, not penny now. So they will not take kobo from you. So don't be intimidated that the checking your eye will cost or will be costly. Because of that, you don't want to go to hospital.
All right, viewers, the message is once you're 35 years and above, ensure you check your eyes once every year. I think it's a cheaper thing and the best thing you can do for yourself. And secondly, for people who have family history of glaucoma or any blinding disease, it is a must that you check your eyes, in fact, more regularly. Okay, so that was the summary on the film, The Still Water. Now, the last film which we talked about was on ocular injury, and we learned that accidents do occur and they may not give information ahead of time. But oftentimes there are scenarios or settings or certain activities that we do know can readily lead to eye injury. And we can do a lot of good for ourselves if we avoid or take necessary precautions on those situations. So accident may be accidental, but oftentimes they are not caused. They are not accidental. Oftentimes they are caused. So let's be very observant and let's be watchful and let's do all that we can do to preserve these two balls that God has given unto us. Okay, so as we now begin to round up on this episode, once again, I'm privileged to be sitting amongst eye doctors, you know, and with whom we share same passion and same focus, and that is basically educating every one of us on eye health issues. Now we are going to go back to a key point, because you discover that this kind of program is not for one person, it's for the whole community, it's for the whole populace. And we find such act to be cheaper and more beneficial than when you're just talking to one person and then you keep spending time, spending resources. Also, there's something we call community ophthalmology. Community outreach is where you put a group of people together, examine their eyes together, give them lectures together, treat them together. We do expect that communities organizations, religious bodies can approach any eye hospital next to them and say, please, can you come to my town or my city and screen? And I'm sure they will be willing to oblige us. But so let's go back to where we're going to be wrapping up. What can individuals or the good people of Nigeria, how can they be a part of community ophthalmology services? Or how can they be a part of prevention of blindness? Because prevention of blindness is the business of every one of us. Either you are blind or you are not. Either you have eye challenge. Everybody has a role to play. So let's start this way, Dr. Ayoni. Individual persons, are there things they can do to support prevention of blindness?
Thank you, my bro. Individually and essentially, there are many things we can do at a private level that we make us to prevent all the blinding condition. For instance, a mother now, the food she serves her children is very important. You don't necessarily need to buy something that is very expensive. For instance, let's take a vegetable, green leafy vegetables. We call it efo. There are a number of them. You have ugu, you have tete. So all these ones, they are but the way you prepare it is very important, so that the nutrients that are very essential for vision will not be lost. Then palm oil, they are very important because they are very rich in vitamin A, which are very essential for vision. So what we give our children, they are not necessarily expensive things that can make them to have good vision. Then as parents in the house too, children, they would normally offend us one way or the other. So we should make sure that when we want to, maybe when we are annoyed, we want to punish them. In fact, nowadays, it's not even right because children avoid all the physical injury, getting cane and be caning children. When a child is fearing the cane accidentally, and then the parent, somebody is also annoyed. He want to hit the child on the palm only for the cane to land on the eye. So that one we prevent if we adopt what we call non-physical corporal punishment. We can ask a child to maybe close the eye, raise up the hand, or maybe for some minutes, rather than using physical. Then when our children are playing at home, we should make sure, even when we are cooking in the kitchen, or we are busy in the house, we should endeavor to be checking them once in a while. Are they holding stick? Are they holding stone? Because while children are playing, many of them, they do sustain eye injury, because innocently they may be throwing stone or stick, and then it lands on the eye, causing eye damage. This one is very common during what we call unsupervised play, especially during holidays. Children, when they are on holidays, the parents, they are used, in quote, they are not used to having them around. Maybe the parents, they are at work. Another way individual can contribute to eye health is by supporting eye care services. We have many people around, but we still need more. We are like Oliver Twist, because the burden of eye problem is increasing. Our population is increasing, and because of that, we need more hands to assist. We can actually assist by maybe collaborating with eye care. They are everywhere. We have eye care association, either in form of Ophthalmological Society of Nigeria, either the other eye care worker and nursing association, optometrist association. If we reach them, they know how to channel. We can, if actually we are interested, we can actually ask them, okay, this is what I want to do, so that we are sure that our money is actually utilized. Some eye care clinic, they don't have equipment, so we can support such eye care eye clinics Then there are many indigent patients, like especially cataract now. So we can partner them to, okay, I want to support one cataract patient. I want to support, depending on our pulse. Yeah. That one will go a long way to assist. Those are areas where individual can actually come in. We can also support the health centers in our schools, or even collaborate with the school to have what I can call school health center, because most of our school, they don't have school health center where first aid can be administered. We can encourage schools to have health centers. In addition, individual can actually work with schools by assisting the school to build health center, because most of our school, they don't have health centers. And that in that health centers, they may employ a nurse or any appropriate health worker who will be managing that place, and then we provide all the necessary basic drugs and then equipment that can be used to administer first aid, so that children having injury or having other eye problem can easily be attended. And such health official will be able to accompany such children who need assistance to standard hospital where appropriate care can be given.
Yeah, viewers, you've heard so much about what individual people could do to support prevention of blindness. And you must know that as small as 20,000-30,000 naira can restore sight to a blind person. I mean, what joy you can be used to give to some people who are blind and they don't have the means to get their sight restored. So, well, it's good to celebrate birthdays, naming ceremonies, graduation ceremony, you know, burial of very aged parent. But rather than buying 2, 3, 4 cows and, you know,
we all eat.
We eat and then we forget that we've eaten. We can channel some of those funds to restoring sight to many indigent people who are blind. And you can imagine what joy you will give to such individuals. And more importantly, when you empower people by restoring their sight, you actually take them off from begging. Yes. You know, they can now be productive, they can then work, they can fend for themselves, they can care for their families. So we're encouraging individuals, just meet the nearest eye hospitals around you. Find out where you can be of help. Sometimes it may just to be able to direct somebody appropriately to say, oh, you have an eye problem, there's an eye hospital there. Oh, you cannot go by yourself because you're blind. I'm going to take you there. Many blind people need a compliant person. That may not require so much of your money, but definitely you will have contributed to prevention of blindness. And now we're going to just leave that. Dr. Abikoye, what can corporate organizations do? You know, companies, religious bodies, can they have a role in prevention of blindness?
Yeah, thank you, ma. We know corporate organizations have what they call corporate responsibility. So to me, I feel it's better for them to be part of campaigns like this, helping to restore vision to those who are needlessly blind. And that's a form of advert that is, on the long run, it will be far more cost effective than the one we see on televisions and social media, because each individual vision that is restored, that individual will forever telling everybody that it was so and so company or corporation that helps to restore my vision for me. So I think religious bodies, companies, even clubs like Rotary Club, doing a fantastic job helping with blindness. So I'm encouraging corporations or corporate bodies to stand up to the challenge and sponsor cataract surgeries.
And not just cataract surgery, we can sponsor detection of glaucoma, we can sponsor health education programs, we can sponsor child health care, you know, providing eye care for children, several things. Okay, viewers, you've heard it all. The fact that individuals, organizations, religious bodies, you know, everyone has a role to play when it comes to prevention of blindness. And there's no amount of money that is too small or too big. But let me, on this note, thank a number of organizations and corporate bodies that we know over the years. They have not sent me, but we do know that several organizations in Nigeria have been part of prevention of blindness in one way or the other. Sight Savers, Rotary Clubs, Lion Clubs, you know, Guinness, you know, Guinness built Guinness Eye Centers, you know, several religious bodies who organizes eye camps and eye programs. For all some of the people that have worked with us on this program and several other community works, SIP, you know, some individual people, you know, we don't want to be mentioning names so that you don't think we are doing advert for them. But truly, what we're trying to say is, what we're asking the people to do is not new. There are some people, as individuals, as families. Now I have several families come and say, okay, my mommy has passed away. Can you do 20 cataract surgery from your hospital, from the teaching hospital where I work, to commemorate or to mark this burial ceremony? I think those are lofty ideas, you know, and we want to encourage every one of us to just come in. You don't need to travel far. Go to the nearest eye hospital to you, government or private. Ask them, how can I be a part? How can I contribute to restoring sight? How can I give smile to people? How can I make people happy, you know? And as you give to people, you know, God has a way of also blessing every one of us. Well, I guess we've said so much today on Sight Ed, on other films. We still look forward to producing so many other films on eye injury. The lists are endless. The lists are endless. But as we have the means, the time, we'll keep, you know, passing these messages across to every one of us so that we can get learned, we can get knowledge, because knowledge actually is power. Okay, so on Sight Ed, we'll try to put an end to it here. I remain your host, Feyi Adepoju. Sight Ed is a sight educational program designed to enlighten every one of us on eye health issues. Please keep on with your comments and questions and queries on all our social media pages, and we'll keep responding to them. And before next time when we meet again, we pray that all of us will enjoy good sight, and as many that have one eye issues or the other will be led appropriately to appropriate places, and they will receive good help. See you next time. Thank you.